about what the numbers are telling us. And then, of course, we will look at our vaccination rollout program. And then the Premier will close the session. So without any further waste of time, I would like to invite Dr. America Wonga to come and speak to you.
Thank you very much, DG. Good morning, Premier, MEC for Health, MEC for Education, all protocols observed. Welcome, everybody. So, as the Master of Ceremony just said, I'm going to do the first presentation, and Professor Melado will do this next presentation after me, where he'll speak about the modeling that's being done for Gauteng Province. I'm going to do an overview of the epidemiological trends in the pandemic in the last few weeks. So, just to start off with, I thought maybe I should give the end before the results. So what is it that we want to talk about today? So I'm sure you've all noticed Gauteng Province is experiencing a resurgence of COVID-19 cases, and this has been ongoing for the past 3 weeks. We've been seeing a rapid increase in the widespread community transmission. So in other words, what we've seen is the virus spread from the initial clusters that were identified in Swane district is now present in all the districts. And what we've noticed also is that the risk of COVID-19 in the community has increased. And there are a number of indicators that tell us this. And I'll present some of those indicators in this presentation today. One of them is the 7-day rolling average of daily cases, which we've seen a very rapid increase in that. We've seen more than 20% per day increase in the 7-day rolling average on average this past week. We've also seen an increase in the proportion of tests that are positive, which is a very strong indicator of the level of community transmission. And that's gone above 10%. We've also seen an increase in the reproduction number to 2.3, which means that the number of people each infected person can infect has gone from 1 to about 2 people per person. We've also seen an increase in COVID-19 admissions, but not to the extent that we've seen cases. And also, in the last week or so, there have been reports, as you all know, that the resurgence in COVID-19 is driven by the new variant of concern called Omicron. So I just want to show a few slides to just highlight some of these things that I've spoken about just now. So the first one is the point we're making is there's been a rapid and sustained increase in COVID-19 cases in Gauteng. So just as a case in point, the most recent data for yesterday showed there were just over 6,000 daily cases of COVID-19 reported. And 6,000 is actually the number of daily cases that we saw at the peak of the second wave and the first wave. So it's a large number of cases in one day. The 7-day rolling average of daily cases has also increased to just under 3,000. And the rate at which the 7-day rolling average is increasing right now, we're very likely to hit even higher numbers of cases before the end of this week. So just one last point about the number of cases. If we compare week on week, the last epidemiological week that ended 27th November, we reported 9,159 cases, which was a 330% increase in cases per week compared to the previous week. So these data are just showing us that the rate of infection in the community has increased. I want to now just focus a little bit on the districts in Gauteng. So the table there in the middle is telling us that there's been a rapid increase in cases in just 2 weeks in all our districts. Just to give an example, in Gauteng, in the week ended 13th November, we reported 155 cases just in that week. But 2 weeks later, in the week ended 27th November, we reported 3,585, which is a 20-fold increase in new cases over just that 2-week period. So that is one of the concerns. The other point I want to make on this slide is about what's called the incidence risk. So the number of new cases per week per 100,000 population per district has been increasing. If you look at the two maps on this slide, the map on the left is showing the picture on the 27th of November 2021. And the different colors are showing the levels of risk. So blue means the low risk, orange is medium risk, and the red is high risk. As you can see, on the 22nd of November, there was only one district in the Northern Cape that was high risk, and the only district that was medium risk in Gauteng was Tshwane at that time. But by the time we got to the 29th of November, a week later, only one of our districts, Sedibeng, is now medium risk, and all the others are in a high risk situation. So that's, again, just an indicator of the increase in infection risk. We've also seen a rapid increase in the test positivity. That's the proportion of tests that come back with a positive result. So again, as you can see from that curve, we have gone above the 10% mark, which is the threshold for high risk of infection in the community. And 5% is actually the WHO's threshold for high risk of infection in the community. So just like the cases have gone up, we've also seen a rapid rise in the percentage test positivity, again an indication of an increase in community transmission in our province. The last thing I want to show about the test positivity is this map is showing the test positivity rate in Gauteng districts. So a red color shows very high level, test positivity, above 30%. And 3 of our sub-districts in Tshwane have test positivity above 30%. The others have test positivity above 20%. And then the other districts that are in pale green and beige have lower test positivity, which is below 20%. So at the moment, Tshwane is leading, but the other districts are following very closely behind. So I want to say just one thing about Omicron. There's been a lot of information in the media. We know that it's now a new variant of concern, and this is what's driving the resurgence in Gauteng. And the most recent report from the NICD and the Genomic Surveillance Network in South Africa that was released yesterday shows that Omicron is now dominant in Gauteng. And if you can look at the graph at the bottom there, it's showing the percentage of all genomes that were sequenced in the last 3 weeks up to 27th November. You can see there the red, okay, I don't have a pointer. The red bars are Omicron. The green bars are Delta. So you can see the week prior to the week 44, which is the week prior, Delta was still fairly dominant in our province. But starting from week 45, 46, 47, we're seeing Omicron as the dominant variant. So a lot of work is still going on to understand what the significance of Omicron on severity and so on. So we'll report that as the data becomes available. So I just want to say, based on what I've shown so far, we've seen a very rapid increase in cases in Gauteng, and this is a concern. The resurgence is always a concern to us. However, we just want to make a few points. The first point is that the Omicron variant is still SARS-CoV-2. And SARS-CoV-2 is transmitted the same way, regardless of what strain it is. So it's still transmitted from person to person, contact between people through aerosol transmission. And as far as the information we have available, the same measures that were used for previous variants in previous waves remain important, even now when Omicron is dominant. And these include 2 main areas: adherence to non-pharmaceutical interventions and vaccination. Vaccination actually is probably the most important defense at this moment against SARS-CoV-2, regardless of which variant we're looking at. Currently, there's no evidence that says COVID-19 vaccines that we use in South Africa are not going to work against Omicron. And what we've done is we've been looking at the data in Gauteng, and we've noticed some trends in the Gauteng data. And these trends are giving us some early indications that the vaccines are actually doing what they were designed to do, which is to protect vaccinated people against hospitalization and against death. So analysis is still going on, but we have some early indications, which I just want to show in 3 slides. So the first slide, the point I want to make is that hospitalizations are increasing, but at a much lower rate than the cases, and also at a much lower rate than we saw in the 3rd wave. Just by comparison, during the 3rd wave, when Gauteng was reporting 90,000 COVID-19 cases per week, which is the number of cases we saw in the weekend of 27th November, we were reporting 5,777 new admissions in a week. But in comparison this time around, when we're at 9,000 new cases per week, we only reported 418 admissions that week. So it's giving us some indication that the rate at which cases are increasing is significantly faster than the rate at which hospitalizations. And this is leading us to believe that vaccination is probably already beginning to see an impact. So it's protecting against hospitalization, which is an indication of severe disease. The second point I want to make is that we've seen a shift in the distribution of hospital admissions in terms of age. So I've got a number of graphs here. I want to first start with the one in the left-hand bottom corner. So this one might look a bit weird, but what it's really trying to show is the different colors are showing the different contributions, the proportionate contribution of different age groups to hospitalizations in Gauteng hospitals since the beginning of the pandemic. So when you see, like at the top there, you've got the dark blue. Those are the people over the age of 60. So through most of the pandemic, and particularly in the third wave, those are the people who've shown the biggest contribution, as well as the people over 50, which is the green one. So they were contributing over half, more than 50% of admissions. But as you can see, as the pandemic has progressed, and particularly in the last 4 weeks, we've noticed that people over the age of 50 and over 60 are contributing a smaller proportion of all admissions in our hospitals, new admissions to our hospitals, whereas people under 40, which is the yellow bar, going all the way down to the bottom, are making a bigger contribution to our hospitalizations. And just to emphasize that point even further, on the right-hand side, I've got two graphs. There's one graph there at the top is showing the number of hospitalizations by male-female, which is the bars. The orange dark bar is the males, and the light one is females, and the light one is males. I just want you to focus on the line. I want you to focus on the line that goes from 0 to 9 all the way up to over 60. So you can see what that line is showing is the older, the people who are in hospital were more likely to be over the age of 60 than the younger population. However, we've seen a change in the last 4 weeks. If you look at the graph at the bottom and follow the yellow line that's going from 0 to 9 age all the way to above 60, you can see that the percentage contribution of people between the age of 20 and 39 in our hospitalizations is 43%, when over the pandemic it's been around 21%. So we're seeing an increase in the percentage contribution of people between the age of 20 to 39. And at the same time, we've seen a reduction in the contribution of older people over the age of 50, from 57% to 24% of all people who are hospitalized. Again, this is showing us, it's leading us to believe that perhaps the vaccines are now working, because we know that people over the age of 50 in our province have higher vaccination coverage than people under the age of 30. And then the last point I want to make is about deaths. I know we usually wait for about 3 weeks or so before we make a statement on whether the wave of deaths is taking off the same way as cases. So we've been with this resurgence for about 3 weeks now, and Omicron was identified about 3 weeks ago as well. And so we feel that maybe this is a good time for us to look at the deaths, to give us an indication of where we are in terms of severity of COVID-19. And what this graph is showing is the death waves, wave 1, wave 2, and wave 3. And you can see wave 3 was the largest. At the bottom right-hand corner in the red circle is showing the recent deaths that we've been reporting in Gauteng in the last few weeks. And just to indicate that in the week ended 21st November, we had 14 deaths reported in that week. And the week ending 8th of November, we had 25 deaths reported in that week. And just to do a crude comparison, during the third wave, when Gauteng was recording 9,000 cases per week, we were recording 475 deaths per week, which is a lot higher than what we're seeing now, which is about 25 deaths a week. Obviously, we need to monitor this data and continue monitoring to see whether we are able to sustain this reduction in deaths. And the message we really want to put forward is for us to sustain this lower rate of increase in deaths and hospitalizations, vaccination is our big solution. So we're really urging those who are not yet vaccinated, please vaccinate now, sooner rather than later, to protect yourself against hospitalizations and deaths. That's really the big solution. And the second thing is, even as much as we're doing vaccination, please let's continue to adhere to non-pharmaceutical interventions. And the ones we really want to emphasize is wearing masks, avoiding large gatherings, especially if they're indoors. I know right now the alert level 1 allows biggish gatherings indoors, but let's behave as if we're in alert level 3 and avoid large gatherings. We don't really have to do them if we don't feel that it's not safe and well ventilated. Avoiding prolonged contact in confined spaces, ensuring well-ventilated spaces like this, sitting outdoors is absolutely better than having indoor gatherings. I just want to end by reminding us that vaccination and non-pharmaceutical interventions must go hand in hand. So to stay safe against COVID, vaccinate and ensure that we wear our mask, avoid crowds, and open windows. Thank you very much. I'd like to hand over to Prof. Melado.
Okay, thank you very much, Premier, MECs, DG, and thanks a lot, Dr. Kawonga, for the excellent presentation. I will be focusing on the modeling, the predictions, where are we going to, and what it means to have such big numbers as already Dr. Kawonga eloquently indicated. So this graph here serves as an introduction. You see there the number of daily cases in Gauteng. You see the first, second, third, now the beginning of the fourth wave. What is very important to note here is the very fast increase in the number of cases. We are observing levels of acceleration that we have not seen before in the pandemic. This basically means that we have to recalibrate all our models. We already had models for the fourth wave before it began, but because there's been a change in the virus, we now have a new variant that has taken over, as Dr. Kawonga indicated, that appears to be more transmissible, and as a result of that, numbers are going much faster. This basically means that we have to recalibrate all the modeling that we have built for the province. A very important aspect that we have to have in mind before I dive into the modeling itself is the fact that we move a lot in the province. So if you look at the graphs there, and especially the red orangey one, you can see that the levels of mobility we have in the province are the highest since the beginning of the pandemic. This means, as already Dr. Kawonga indicated, that while the fourth wave appear first in Tshwane because we move a lot, that virus that is highly transmissible is pretty much going everywhere else in the province. That's a very important aspect that we have to have in mind to understand where we are and why we have such a fast growth in community transmission. It's important to note, which I will reiterate later, that mobility is very high and will likely continue to be very high up until the point where many people will leave the province and take the virus elsewhere. Okay, let's dive into the predictions. Before I do so, I want to say a couple of words about how we do it. So this is a graph of the third wave. If you remember, we are facing now a similar situation compared with what we had during the third wave, We started slow, but then the Delta variant came in, which was more transmissible than the variant that was dominant then, and then we had a strong acceleration in the numbers. We were forced to recalibrate the models. We did so, and after the recalibration took place around about end of June, the model actually worked fairly well. You can see there a comparison of the data with the model. So the procedure that was adopted in order to dynamically calibrate the model appeared to work fairly well. So we have confidence that it will work well for the fourth wave as well. So this basically brings us to where we are today. As soon as the new variant was announced by our experts. We activated a very similar procedure to the one we used for the third wave. We developed a new model, and you can see there the comparison between the data and the central value of the model, showing that after it was calibrated, the data seems to be following reasonably well the modeling. Now, what does this mean? What does the fact that we have a more transmissible variant dominant? It means that as the numbers go, as the community transmission grows faster, the peak will be somewhat higher compared to what we had predicted weeks ago, and the peak is moved forward. That's what it means. So what you see in the graph there is that we are going to be seeing a quick, fast rise of numbers still this week and probably the next, and we should peak round about the second week of December. Now, one can argue, well, the peak is coming very fast. It's natural because we have high levels of transmission, but it's very important to bear in mind that a peak of a wave, a peak of a resurgence, is not the end of a resurgence. Because if you see the predictions there, we're going to have high levels of community transmission still into January. So this means that the fact that the peak is coming earlier should not prevent us from going and get vaccinated. We're going to have very large numbers still past the new year in January. That's very important to note, and that's a very important message from the modeling aspect. This graph here is the same, but now we put the projections in perspective, and we've changed the scale of the y-axis to indicate how high the level of transmission was during the third wave. So we reached 100,000 cases during the third wave. Here we are somewhat lower than the third, but the third was a very serious situation. This basically means that the fourth wave and the peak of the whole fourth wave will still be quite significant. And the fact that community transmission is so fast is not helping. As a result of that, the size of the peak, the amount of active cases we expect to have at peak has increased considerably compared to the early modeling we showed weeks ago. Now we have to move into hospitalizations. One of the reasons why we do modeling is to understand what will be the worst case scenario, how many beds will be required at peak and post-peak. And for that, we basically do two types of modeling. We first look at the occupancy model. We try to understand and model the fraction of people that get admitted to hospital as a function of different variables, and there is a model that's been developed that describes the data reasonably well. This is a level of a model of hospitalization that comes before vaccination took place. Now we have to take into account vaccination. Vaccination rates need to be modeled, and what you see there on the graph is the overall rates of weekly vaccinations on the upper left graph. And then the following graphs, the upper right and the two lower graphs, are the rates of vaccination in different age brackets. You see on the upper right corner the rate of vaccination for people over 60 with a well-pronounced peak, a drop, and hopefully is picking up again. Same situation with people between 50 and 60. And unfortunately, the graph on the right indicates the rates of vaccination for people between 18 and 50 is dropping. This is where we have to really go in and try to encourage people to get vaccinated. We see now, as Dr. Kawonga indicated, that we're getting more and more young people in hospitals. And one of the reasons why we think that is the case is because the coverage is significantly lower in younger populations. I'm showing the same data but with a different view. This is a cumulative set of graphs where we basically look at the coverage. On the y-axis you have the coverage, the percentage of that population segment that is vaccinated. The upper left is the overall adult population. The upper right is over 60, which is progressing towards the target, which is great. Of course, we need to accelerate that as well. Similar situation with people between 50 and 60. Unfortunately, the level of vaccination and coverage for people younger than 50 is certainly not at the same level. It's up to a factor of 2 lower. And that is something that is a major source of concern. Putting all that together, we now have the preliminary set of projections for what we think is going to happen during the 4th wave. These projections work reasonably well for the 3rd wave, so we have some level of confidence that they will give us a feeling and reasonable understanding of where we're going to be. So what we see there's different scenarios, of course, but what we see is that roughly we should expect a peak around 4,000 beds at peak, compared to 9,500 during the 3rd peak. Now, while this is good news in the sense that the peak of the 4th wave in terms of bed occupancy will be lower, it is still quite significant. This is a massive amount of occupancy that will strain the healthcare system. And as a result of that, given the fact that the 4th wave is, and the peak will be quite significant, we encourage everyone to get vaccinated to significantly increase the rate of vaccination. Thank you very much.
Thank you, Prof. I'm now going to call Dr. Adil Chikovu to talk to us about the vaccination program. And then, of course, he will be followed by the Premier. The other part of the presentation, which talks about the numbers or the new cases, we're going to skip that one because we've already covered a lot of that through the presentation made by Dr. Kawonga. So, Dr. Chikovu, please come forward.
Good morning, Premier, MECs, DG, all protocol observed. I'll take you through the latest update in terms of our vaccination, where we stand as a province. I'm just waiting for that to come up. But I must just indicate, Premier, we have started off on a very good note. Since Monday, we were very worried, but it looks like the province is back to regaining its momentum. The numbers are looking good. And if we are to maintain that momentum, then we are very confident that we are getting somewhere. So the data we'll be presenting is the vaccination status as of last night. So this is very, very fresh information. And I know there may be variations here and there between what is actually displayed on the SA coronavirus and other national dashboards. But what we are presenting here is the very latest of information. Okay. All right, thank you. So we start on this slide. Premier, you can see that we have just gone over 7 million vaccination as a province. And this milestone was actually achieved on Tuesday. Tuesday, we crossed the 7 million mark as Gauteng province. And that's approximately 27% of the vaccinations which have been administered in the country. As a country, we have done 25,828,435. What we are able to see here is, in fact, the profile, our performance as a province. This is across all other age groups, with the exception of the 12 to 17-year-olds. We have not done very well when one is looking at the graph, but it must also be understood in the context that Gauteng is the most populous province, with almost 12.6 million eligible people for vaccinations. So that large denominator obviously is bringing us down, coupled with the fact that in our case, 80% of the vaccines that have been administered are in fact a double dose. So you only get to achieve fully vaccinated after approximately 42 days. On this slide, we can see the performance once we standardize for 100,000 of people. So what we often do in statistical terminology is we standardize for 100,000 people in exactly the same way that when people or students take tests, one test may be out of 10, another one out of 20, but for a fair comparison, you then convert into percentages. So it's exactly what we do. And then you can see in terms of vaccines administered, we are on position 5. In terms of individuals that have been vaccinated, we are on position 7. And in terms of individuals fully vaccinated, we are on position 7 as a province. On this slide, we can see the status report as of the 1st of December. So this is just the distribution of the 7 million vaccines which have been administered. And you have got Johannesburg leading with over 3 million, followed by Tshwane at 1.6, and then Ekurhuleni 1.5, Sedibeng 338,000, West Rand 475,000. However, the picture changes when you then standardize for the underlying population to be served. And maybe I'll skip this one because the same information will actually see it. In terms of performance, in the last 24 hours, if you adjust for the population that is being serviced, then West Rand has pulled the trick and is actually now leading in the province. So this is the distribution of the number of vaccines that have been administered, and we have also indicated here the total population in the province, the adult population. For the adult population, we are looking at 18 and above. In other words, we have excluded the 12 to 17-year-olds, but we do have information and data pertaining to the 12 to 17-year-olds. And then we also have the individuals that have been vaccinated as a function of the adult population. And you can see in terms of individuals that have been vaccinated, the big number there is 4.5 million. And that will actually translate to 40%. So that will actually translate to 40% of the adult population that have been vaccinated. Then of that 4.5 million, 3.7 million are fully vaccinated. And that actually translates to 33% of the adult population that we are actually targeting. So that is the status of our performance as a province. Then if we then look at the 12 to 17-year-olds, in the province we have 1,297,967. And of that figure, 102,725 have been vaccinated. Remember, for this cohort, they only receive a single dose of Pfizer. So in terms of coverage for this particular age cohort, it actually translates to 8% coverage. So this is just an indication of the coverage as well as the fully coverage in terms of thermometers for ease of reference. There is our performance as a province, 40%. And then again, after standardizing for population to be served, as I've indicated, West Rand has actually come on top in the last 24 hours with 45%, followed closely by Johannesburg at 44%. And this is also the very same trend and distribution when one then looks at the individuals that are fully covered or are fully vaccinated. Remember, for us as a province, the gap between vaccination coverage and fully vaccinated is almost 42 days, because that is the interval between Pfizer dose 1 and Pfizer dose 2. Otherwise, for Johnson & Johnson, straight away, a person is fully vaccinated once they receive their jab. This is the performance when we then look at the 4 age groups, the 18 to 34, 35 to 49, 50 to 59, 60 and above. I must indicate, Premier, we have not been doing very well as a province, especially when one is looking at the 50 to 59 as well as the 60 and above. The performance that we are seeing here, the statistics, they are also a function of the time. There's been a lot more time on 60 and above, followed by 50 and 15 to 59, but the percentages, they remain very, very low compared to the same age cohort in other provinces. So this is the distribution. We are looking at both gender as well as the age group for the number that have been vaccinated in terms of the vaccination coverage. And roughly we have a split of 54% females to 46% males. So we still need a lot more males to go and get their vaccine, so that at least we would really love a 50 to 50, alternatively 51 to 49. This is just an indication of our profile performance in the last 5 weeks. Last week in particular was not a very good week for us, but as I've indicated, we are happy. It looks like we are now making up for this week. We started on a very high note this week on Monday, followed by Tuesday. Yesterday was Wednesday, a slight drop compared to the other 2 days, and by tonight we will see what today's performance looks like. But we are very confident with the new initiative that has been embarked on, the school zone-based vaccination program, that very soon these numbers will show an upward trajectory. So that concludes the report that I have to present, Premier and principals. Thank you very much.
Okay, thank you very much, Dr. Chikovu. I will now call upon the Premier to come and speak to you.
It's working? Yes, it's
working. Good morning once more. I want to acknowledge the MECs for Health and the MEC for Education and our senior officials from the departments, particularly the Department of Health and members of our advisory committee. The first thing we would like to just emphasize is that our province is at the cusp of the fourth wave, at the cusp in the sense that with the new variant, we are the principal focus of this variant. So from the report that was shared with us, so we are monitoring very, very closely, getting feedback from our clinical teams also on the full impact of this. As we see the numbers every day, we're very, very concerned about what the reports are from our clinical teams. In other words, what those who are in the front line of our health services are reporting with regard to the symptoms. So Dr. Mary Kaunga has already indicated to us that whilst these numbers are rising rapidly, the infections are rising rapidly, driven from the north of our province. That is in the city of Tshwane. That's where the new resurgence is coming from our universities in particular. The universities in the north are that is TUT, Tshwane University of Technology, Sefako Makgatho, which is our medical school, and the universities in the center of Tshwane, the University of Pretoria, and UNISA. That's where the major observations were coming from, that we have something new happening in our universities, especially amongst young people. So we have expressed this concern about the rapid rise of infections. And at least last week, the report was that this is driven by a new variant. Before that, we just thought it is just an outbreak, cluster outbreak. Before that, but we did see that the infections were rising very, very rapidly. We are continuing to monitor what is happening at the clinical level, the feedback from our clinical teams. The Premier's Advisory Committee is also made up of clinicians who are able to give us feedback. So the information shared by Dr. Mary Kaunga is also coming directly from the clinicians who are members of the Advisory Committee. And as we do that, we're also doing contact tracing. There's been very, very good contact tracing, especially in the north of our province when the outbreaks happened 2 weeks ago. Significant work was done, and that work is continuing by our health contact tracing teams. We have also increased the number of contact tracers to help us track down this. It is already clear that those who are not vaccinated, especially amongst the youth, they are the ones of great concern to us. Even though the information is still at an early stage, but it is clear that the people who are not vaccinated would be people of great concern. So it is absolutely important that we continue to send out the message that vaccination is important. We urge people to take their jabs because this, even in the very early stages, those who are vaccinated are only showing mild symptoms. At this stage, this is good news. I must say that when the news first came of the new variant Omicron, all of us were concerned about whether the current regime of vaccines will work or not. The preliminary sense is that the contrary has not been proven. The contrary is that the vaccines don't work. That preliminary sense is important. Our team is also working with other teams from across the country, including in KZN and the Western Cape, just to compare the clinical evidence that's coming around the impact of this variant on hospitalization. Dr. Mary Kaunga has already indicated that so far the news are positive for us. We want to call on the people of our province to step up the vaccination. This week, the good news is that we are back at above 50,000 vaccinations a day. That's the good news for us. So Monday, we got 51,000 new daily vaccinations. Tuesday, we got 54,000 daily vaccinations. Yesterday, Wednesday, we got 51,000 daily vaccinations. If you know where we were, we had fallen just even below 30,000 vaccinations a day. So from Monday, it's good news for us. We would like, as our team is saying here, Dr. Chikovu and the team from the Department of Health and our partners on the vaccination. The critical issue is that if we sustain daily vaccinations, about 50,000 throughout this period into the festive season, it will help us to be able to reach at least another 500,000 people before they leave Gauteng. And we want to emphasize that we need to catch people here in Gauteng and vaccinate them, because we know during the festive season, millions of people leave our province for other provinces. We don't want people to be carrying this variant to other provinces, especially those who are not vaccinated. It's better that they vaccinate. We know the advantage of being in the province like Gauteng is that access to health services is much, much better. So we want to emphasize and really stretch out this call. This week, the people of our province have done very well. And this we see also amongst younger people. It is for that reason that the MEC for Education and the MEC for Health have partnered on a drive over the next 2 weeks. We want to reach young people. So we have a program that's focusing on all schools, school-based, what's called school-based zonal focus. And today, the door-to-door work we were doing here, we are targeting young people in our schools. We gave them time to write exams. They've completed their examinations, especially the young people between the ages of 12 and 17 who couldn't vaccinate for a while. We are targeting them. We are going to continue this vaccination drive focusing on young people in our communities. And we have ensured that in Gauteng, the schools are going to be open as vaccination sites. even as we go into the festive season. Even as the schools close, the schools are going to be open as the vaccination sites. Yes, we are targeting young people, but we are also going into communities. Around the schools in Gauteng, we are going into communities to get the message of vaccination. Vaccinating is better. It helps us reduce the risk of severe disease and hospitalization, and it also reduces the risk of death. And this is the message we would like to continue to take out to different parts of the province. We still want to also say, we know a lot now about COVID, wearing masks, social distancing, washing our hands as regularly as possible will help us a great deal, and avoiding crowded spaces. We know as we go to the festive season, the tendency is there for parties to escalate, Christmas parties, including for workplaces, for employers, for businesses to have Christmas parties, for young people to have parties. But in the province, we say this is dangerous time for that. It is extremely dangerous time because the positivity rate is very high, as was reported by the Dr. Mary Kaunga. I go to places every day across the province where I get told, in this place we have 2 people who have tested positive for the new variant in this area. So we must send a message loud and clear that coronavirus is out there and the new variant is out there. It's not just in Tshwane, it's not just in Johannesburg, it is out there. It is all over our province. So let us avoid those risky behaviors of huge public gatherings that will put us at great risk. It is absolutely important that we should continue to do the things that we do. The difference between now and last year in the run-up to Christmas is that we didn't have vaccines last year. And now we have got the vaccines. If you want to listen to the central message of today's media briefing, is that we can beat the 4th wave. And the only way we will beat the 4th wave is that we have more vaccines now than we have ever had. There's no shortage of vaccines. We can vaccinate. We have 8 million people in Gauteng who are not yet vaccinated. The number of those who are vaccinated, 4.5 million with single doses, 3.7 million fully vaccinated. But we still have 8 million people who are not vaccinated. The risk for them to be admitted, to be more sick, to be admitted in hospital, those 8 million people are a problem for you and I. So we want to send out a very clear message there that we need to vaccinate, and vaccination is the most powerful weapon in our hands in defeating the Omicron virus, with the variant. And I want to also say that the reason we are in a better position is that information is power. We mustn't panic. We are in a better position. We have the best scientists in the world as a country. They detect a new variant in the shortest space of time. We know what we are dealing with. We don't wait for too long. There's a problem here. A phone call. Can I answer it for you? We have the best scientists. We have vaccines. We know what we are dealing with, so we can't. The panic response last week was we almost got into a panic response last week. And every little indication that's there is that it's within our hands. We can contain the 4th wave and this variant. The modeling team in our province says, given all things being equal, we are not likely to end in the worst situation than we have been during the 3rd wave. But everything depends on what we do. And And we really, really need to make this continuous call that it's within our hands. We can reduce the real impact of the fourth wave by vaccinating, by avoiding crowded spaces, by wearing our masks, but also by sharing information that is accurate. That the Omicron variant may be spreading rapidly, but it doesn't, so far, for the vaccinated at least, it doesn't appear like we will end up in the worst situation than we have been. So I want to emphasize that what we are going to be doing in the next 2 weeks is really fight. We want to get those who have not come back for their second dose. Remember, even if you are vaccinated, but if you only took your first dose of Pfizer, taking your second dose is extremely important. You are much more safer if you have done your second dose. And I want to also say that my own experience, even during the election campaign, going across the province, we have many more people who have taken their first dose, but we need more people to come back for their second dose in Gauteng province. We are working with health facilities, both in the public and the private sector, to get them ready for the worst. Getting ready for the worst is always important. Our teams have been activating, going back to the resurgence plan, to activate and repurpose more beds. You know, when we go through to the peak of a wave, our health services, once we have gone through the peak, when the hospital admissions are going down, we open more services. But when we get to the peak, we repurpose beds so that we can admit more people. We are doing the same thing, and we have done it now. This is for the fourth time. Again, there's no need to panic. There's no need for us to behave like we have not dealt with this variant, with this virus before. It is still the same virus. It may have different variants. It may have more mutations, but it's still SARS-CoV-2, as the scientists have said. So we just have to do the things we have been able to do to contain the virus more, and know that we will be able to succeed if we do those things we have been able to do before. I'd also like to say that the critical focus again is going to be looking at younger generations. In our province, with regard to you saw the data for yourselves today, the 60 years and above in terms of vaccination, that's the largest number of coverage. We still have a lot more people to cover, but we are happy with the progress there. The 50 years and above are lower than those 60 years and above, but the big concern is those below 40. We have had a hype amongst those below 40, but it wasn't sustained for long. So we're going back to them to say that they need to really, really vaccinate in larger numbers. So I would like to conclude by saying that as Gauteng province, we are dealing with this new variant, deploying the weapons that have proven most effective. And that includes mobilization of communities around vaccinating. The reason we are here today in this community is because we also wanted to get a sense for ourselves. How many people generally in the communities have vaccinated? So far, the door-to-door work we did tells us that there are much more people who are vaccinated, at least those who have taken the first dose. There are much more than we found. We came across young people who still think that they are stronger and they are wiser than the rest of us. We want to just advise the young people there that it is better to take the vaccine. It is safer to do so, and it is something that we want to continue to do. The provincial government is also working with employers across the province to really make sure that the vaccination drive is something that continues in various business premises and in various workplaces. And at this stage, we also want to make sure that various institutions across our province continue to adhere to our message that we've got the most powerful weapons to deal with this wave. So we are not panicking, but we are deeply concerned about those who are still not coming to the forward to take their jabs. I know there may be a question that I want to answer in advance. I want to answer the question in advance around mandatory vaccinations. The best thing is to persuade people first and foremost to take responsibility for their health, and that's what we are doing. So the first thing we do is to persuade more people, and this week, as I've said, we are seeing more people are coming out. We would like to persuade more people to come voluntarily to take responsibility for their own safety and those of their colleagues at work and their family members at home. That's the first thing we would like to do. We want to persuade people, we want to mobilize people, we want to work with communities, community organizations, NGOs, NPOs to mobilize more people. That's our first approach. Because mandatory vaccinations, you only go there really if you see that the risk is still very high for everybody. And we are not saying that it may not be an option for South Africa. The President explained that there's a task team looking at that. But if we end up with too many people here in Gauteng, I say we still have 8 million people who are not vaccinated. They are coming out. But if we end up with still more people who are not vaccinated, mandatory vaccinations may be the only option we have for the sake of all of us. And as I say, you get to mandatory vaccinations only when you have tried all other options. And so far, I must say, so far this week, it has been good. But if Gauteng can sustain the 50,000 daily vaccinations, it will help us reach more people by Christmas. Even if it's 500,000 people, by Christmas, it is 500,000 people that will really enhance the coverage and therefore the chances of immunity across the different population groups in our province. Are we happy with the coverage so far? No, we're not happy. Our province has administered the largest number of doses, 7 million doses as reported. That's the largest across the country, over 26%. But we are a high-density province. We have a huge population. Not only are we high density, but we are a province that has got large number of people. We also have a large number of people who are migrants, including undocumented migrants. We know that it is a matter that is being dealt with at different levels. At least refugees are being vaccinated in our province. We have been doing that. The refugees are being vaccinated. But then the difficulty with undocumented migrants is that if you don't have documentation, it is difficult to vaccinate you because the system so far works on the basis of your identity or at least your passport. So on that note, I would like to thank our team that's working extremely hard, the healthcare workers in this area who have been working extremely hard. We want to vaccinate more people, and vaccination is really the only way. And let's continue to do so. Thank you.
All right, thank you very much, Premier. We will now take questions. Yeah, I see Griselda there. Do we have a mic? Okay. Yeah, let's start. Please introduce yourself.
Good afternoon. I'm Griselda Lewis from SABC Television News. This question could either be to Prof. Malado or Dr. Mary Kawunga or yourself, Premier. When is Gauteng likely, from the projections that we have currently, likely to reach that fourth wave? We're talking about a week, the next 2 weeks, just so that I guess the province's people can prepare themselves. And also, if we're looking at 4,000 beds at the peak, Prof. Malado, I think, had mentioned that. Are we looking at, as a province currently, Premier, at the field hospitals that were previously out there, or is it still too early for that? Thank you.
Okay.
I just want to find out if you can give us a number of how many people in Gauteng have not come back for their second jab.
Okay. Thank you.
Thank you, Khomoza Modise from Eyewitness News. I just wanted to ask, to echo Griselda's questions just around when exactly the peak specifically is for deaths, as well as for infections in the province. And then the issue around undocumented foreigners living in the province. Is there anything specifically that we are doing or you are doing as a province to better reach those people and to work, beyond this obstacle of documentation, because I think we are concerned about them adding to the infections. And then, okay, yeah, that's my first two for now. Thank you.
Okay. Is that all? Do I see any more hands? Please, okay. Okay. Dr. Kawunga will answer some of the questions.
Thank you. And thanks for the questions. I'll take the couple of questions, the one about the fourth wave and the one about the peak. So the way the wave definitions there have been definitions for waves that have been put forward by the South African Modeling Consortium. And we've been using those until the third wave. And so usually they're based on the number of 7-day rolling average of cases, and the next wave is defined as when you get to, I think it's 30% of the peak of the previous wave. So I'm sure you can imagine the threshold for the fourth wave this time around is quite high, because we had a very high 7-day rolling average of daily cases at the peak of the third wave. I think it was somewhere about 12,000. And so the threshold for getting into a fourth wave is a 7-day rolling average of 3,400, roughly, cases. 7-day rolling average. We're not there yet, but what we're saying is the rate at which cases are increasing, and the fact that we actually 2 days ago already surpassed the 7-day rolling average of cases that was the threshold for the third wave, to us, it means that we're in a resurgence. And I think we need to behave like we're already in a wave without waiting for the technical definition to be met. So that's the message we want to put forward. And regarding the peak, the modeling that Prof. Malado presented earlier showed that he indicated that we expect the peak to come earlier than the previous predictions. And so based on that modeling, we expect to peak in about 2.5 weeks, with about 45,000 active cases at the peak and just over 4,000 hospital beds at the peak. Remember, this is the modeling, it's the prediction. Depending on how well we are able to vaccinate and adhere to NPIs, it's very possible that whatever is predicted might not come to pass. And so that's the other message we want to put forward. So there have been predictions, and we know roughly what the dates look like, but there's still things we can do. It's not inevitable that we're going to achieve the numbers that are being predicted. Thanks very much, Alfred.
Thank you, Dr. Kawanga. I'm going to ask Mr. Malotana, Lisiba Malotana, the COO, to answer the question about the vaccination of the undocumented foreign nationals. We will come to it.
No, thanks, DG. There are two parts, two questions that I'll probably try and respond to. One is the issue about the efforts as far as what are we doing as a department to try and trace, and of course, the premise that we move from is that undocumented citizens or migrants are living within the communities, and I think that's the premise of the question, to then say, how do we get around to ensuring that they also get vaccinated. One is there is a national program that was started, of course, just to initiate a process of creating a unique identifier to be able to do. And the same thing that is happening with the school learners. I think just that for the sake of time, we didn't get into the details. Even with the school learners, they are undocumented learners. And the only way we're doing that, because a vaccine must be linked to a unique identity, if there is no identification, then the system or the province, and what we are exploring now is to create a unique identity, whether it's a classroom and using students as an example, the school and as a reference number, so that the vaccine can be accounted for that purpose. And the same with undocumented citizens. It's about then saying, how do we create a system where an automated number that will be unique and can be cross-referenced for those specific individuals for the purpose of them accessing the vaccine. The actual number, I think Dr. Chogobo will talk to it. The second issue, question that was raised, and probably the Premier will deal with at the principal level, but the issue or the MEC is about what is our approach in terms of the capacity towards the fourth wave. And I think the point we always make in our report is that we have created additional capacity since the first wave, and we are quite confident, knowing what the 16,000 infections that we picked at the third wave, and what the colleagues have already explained, that with the rollout of the vaccine, it's expected that will influence the peak, and the peak it's expected that it might not be higher. So the capacity that we've created, over 5,800 and something beds that we've created for the previous wave, should be sufficient to assist us in terms of managing the infections, and the hospitalization should be required. But also, you'll also be reminded that at the trend, although it's still early, the trend is that the infections are higher, but the hospitalization, it's not following as quickly as it should. And if that stays, if that remains, then we should be even better positioned than all the waves. Thanks, DG. I think those are...
Can you answer the question about the number of people who have not taken the second dose? Okay, we'll call Dr. Chikobu to answer the question about how many people have not taken the second jab.
Thank you very much, DG. So in terms of the number of people who have not taken the second jab, I want to start off by qualifying that according to the current SOP as well as EVDS, a person should take the second jab between 42 days and 90 days. So they are only marked as having defaulted after and beyond 90 days. I know that is not something that is in the public domain. Then coming to the actual statistics, we then prefer to refer to pipeline, those that are in the pipeline by virtue of that complication. And what you simply do is you take the number that have been vaccinated, you subtract the number that is fully vaccinated, and as of last night, the difference between the two is 765,210. I will repeat that figure, 765,210. And that is what we qualify as pipeline. In other words, it's everyone who has come back, who has come for the first dose, but is not yet or is not yet due for second dose. So I must also qualify and say that number is actually drastically come down. There was a time when it was above 1.2 million. But we remain concerned, as the Premier has indicated. We still then have to do an exercise to see, of that number, how many has actually gone beyond the 90 days. That I don't have currently. Thank you, DG.
Okay, thank you very much. The Premier will answer the rest of the questions and make closing remarks.
Thank you very much to the colleagues who have responded more accurately. Let me first say that whether declared or not, so whether the fourth wave is declared or not, as Dr. Mary Kaunga said, we are worried about the rapid rise in these numbers, and we want to deal with it as if we are in the fourth wave, whether technically declared or not. That's how we are responding. So we are repurposing the beds, we are preparing the health system. We're going back to the things we have done in the run-up to the peak of the first wave, the second wave, and the third wave, as you know. The third wave was much higher for us. So even with the modeling that is presented before us and with the numbers, the positive reassurances, that this initial sense that the hospital admissions are not very high, but we want to prepare for the worst. In that sense, preparing for the worst means that we want to go back to the capacity we had at the peak of the third wave, which was the worst for us. And that's what the COO was referring to. And to do that, probably just to be more specific, Griselda, the issue of what's called field hospitals just need to be understood. So we have extra capacity in every facility where when that hospital begins to have more admissions, the institutional leadership knows you need to. This is a school. This is very real. This is a school. We are at a school because the learners are our big concern. And you know, there's discipline at the school, so they do ring the bells. So the point I was making, Griselda, is that we are preparing for the worst. And preparing for the worst for us is that the institutional leadership, the CEOs and management of our facilities begin to free some beds in line with the plan. Again, it's the same drill. And that is why I'm saying that we have learned important lessons from the previous waves at the peak of those waves. Even the most difficult of them, which is the third wave, MEC, we never ran out of beds in the public sector. We know we were, both the private healthcare system in Gauteng and the public healthcare system were really overstretched, but we did what we did. Even in the private healthcare hospitals, they were able to create extra capacity of beds, and in our public hospitals, we're able to create extra capacity of beds. So those plans, so every day, our teams are monitoring what's happening with hospital admissions, which part of the province the numbers are increasing. I said earlier on Tshwane. So our first concern would have been the hospitals in Tshwane. And these numbers, this week, the numbers have moved to Johannesburg. So Johannesburg is now having a much more larger numbers, almost the same level, is catching up with Tshwane on daily cases. But we know we have more capacity in Johannesburg. It wouldn't be a big concern there. So we will use the same methods we have used. So what is called field hospitals, essentially, which means you come and set up some temporary facility. We are managing COVID within the existing capacity we have created and nothing is suggesting that we've got to depart from that plan that worked extremely well. By all projections, it doesn't appear like, even with the Omicron variant, we are going to hit way above the third wave, which is what planning must, you have to make certain assumptions when you plan. If you plan, you do your plans based on, will the situation be worse than where it was? And then it is only on that basis, if everything points to the fact that we're going to end up with more people admitted in hospitals, we would then be saying at the peak, which may be, if you look at those models, the peak is somewhere like 2 weeks into December, right into the third week of December, just ahead before Christmas. That's the peak. But as Professor Melado said, reaching the peak often doesn't mean that the infection rate will come quicker down. You may hit the peak, but sometimes it takes long for the infection rate to come down. You may hit that and still continue to have less infections, but over a sustained period of time into Christmas, into January. And hospitalizations, we also learn from the behavior of this pandemic, hospitalizations may increase later. Even with that, in our planning model, we take that into account, that there may be more people following the rapid rise of numbers, but if everything, if we have more people vaccinated, we know that we would not have the same situation at the level of hospitalizations. Let me talk about the undocumented. The cases of, this is a big issue in a province like Gauteng. We have over 100,000 undocumented South Africans. In our schools, we have learners. In our schools, we have learners who are unable to get, even in matric, when they pass matric, because there's a problem in the household. And sometimes it's just a basic thing about information, helping them. In the number of the undocumented, you must take into account that they are both South Africans and they are non-South Africans. So every time we have to implement government programs where the documents are required, we encounter this a lot in Gauteng province. So we have got campaigns with our community development workers to go into areas where we know you can prove that these are South Africans, but there's the 2-3 members of the family who don't have documents, and then there are other family members who have documents. We send Home Affairs to those areas to help register. But we also, the reality is that we are a province that attracts a lot of migrants from Southern Africa. It's the nature of our city region. Like many city regions in the world, so migration is an important issue. Of course, we want people to be legal migrants. We want refugees, those who are refugees, to be granted formal status of refugees. We work with the Department of Home Affairs with regard to the refugees who don't have documents. We work with the various agencies, international agencies, to make sure that the refugees get granted formal status so they can also be assisted. But we also have a big problem about dealing with illegal migrants. And there's no country in the world that will not want to ensure that people are we want people to be in our country legally, lawfully, even those who are running away from wars, even those who are economic migrants. We would like a situation where the laws of our country are followed. So we've got immigration policy as a country. Though that immigration policy must be adhered to, it must be enforced. And those who come into our country need to be doing so lawfully, legally. And those who end up in our country because they are running away from conflicts and so on, the system of government must be able to grant them status in line with our regulations. So we do all that, but you must understand, our healthcare system often deals with people from the point of view that they are patients. If someone arrives at a clinic and they are sick, the role of nurses and doctors is to save life. They have to attend to that person. And that's what our healthcare system deals with every day. They often have to deal with people who may not have documentation. And as the nurses and doctors, they have to attend to those. And the rest of government needs to do its work. So issues of documentation versus undocumented is a big issue. It affects services across the length and breadth of our province. And we are just amongst those provinces in the Republic that are more affected by it. And we still have to save lives. We still have to vaccinate people. We still have to know who is in our province. We still have to account for them. If they are in our province and they are not safe, they are not vaccinated, it is a risk for all of us. And that's why this process of creating unique numbers is part of managing a global risk. A global pandemic does not really care whether you are a citizen or not. If there are too many people out there that are not vaccinated, it's a risk for all of us. So finding them and vaccinating them is just the right thing to do from a public health policy point of view. The more people are vaccinated, the better for all of us. That's the right policy to do. And the rest of government will sort out their documentation and so. So that's something we really deal with every day in health services, in education, and we want these matters to be resolved in accordance with our policies and laws, immigration policy and laws. So thank you very much. I think for the day we are done.